Right on. So this should help you get a little bit more of a visual of what should be happening inside of your body and which muscles to be using on the hip abduction exercise. So what we want to make sure of is that we are not just indiscriminately pushing your leg out to the side, which you can accomplish by just pushing on this little pad that'll be right here. That's not the goal, is not just to push your legs apart. The goal here is to really use these muscles on the outside part of your hip that I've faded a little bit so you can see how the hip joint operates, in order to pull this bony outside chunk of your femur. This little nub here where these muscles attach is getting pulled in all of these little directions. So it's getting pulled up towards the kind of crest of your pelvis. So we're not just pushing straight out to the side. We're thinking about taking this part of your hip joint up and out towards this kind of crest of your ilium, the crest of your pelvis up there. That's what we are trying to accomplish, is using those muscles inside of you in order to move your femur. You can see how now this femur, this little point here, if I can get a little closer, it moves up towards the crest of that ilium. Let's move up a little bit. That yanks onto this outside chunk right here and then pulls it up towards the crest here of the pelvis. That's what we want to be using to try to move your body, move your leg out to the side, is by using those muscles to kind of lift that bony point on the outside part of your hip up towards that iliac crest, not just pushing on the pad. You obviously will be pushing on the pad to move the machine, but you're trying to move your body that happens to be attached to the machine by using these muscles in this area in order to elevate that outside part, what's called the greater trochanter of your femur, that bony outside point here, up towards the crest of that ilium, which happens to be attached to a pad, which happens to be attached to the rest of your leg, in order to move that. So in your brain, you're thinking with both legs at the same time, this is what's happening. You can kind of maintain most of your focus right here in this outside part of your hip. And if you do that, you should be able to get a much better contraction in that area and get more out of the exercise.